Who exactly is at risk for Alzheimer's? Is there a specific age group, a specific ethnicity? Does it favor one gender over the other?
Right. Well, Alzheimer's is most associated with increasing age. So as we get older, our risk of Alzheimer's increases. In terms of gender, there's no real difference in the incidence, that's the number of new cases, between men and women. But because women live longer, there's more likely to be more cases among women with the disease. In terms of other risk factors, we do know that there is a single gene that increases the risk but doesn't determine it. That's something called the apolipoprotein E4 gene. If we have one of those markers, we increase our risk about threefold, and if we have two, we increase it tenfold, but it's still a risk gene. It doesn't absolutely determine the disease.
So is it fair to say that Alzheimer's is genetic?
It's fair to say that there's some genetic component, but in general, when we talk about onset past the age of 65, we call it sporadic, meaning it is not completely determined by anything genetic. There is a form, or several forms, that occur very early in life. They're rare, less than 5% of the cases, and that's what we call an autosomal dominant type of Alzheimer's disease, in which family members are highly likely to be getting it at a very young age. But it is a very rare form of the disease.
And how young could this be?
Most of the symptoms occur past the third or fourth decade, but they can occur even at that age, at that young age.
Wow. So now, with this being something that usually comes, with the increase of age, is there a more common age group that we usually will see this in? Is it once people hit a certain decade?
Well, one of the interesting things is that the incidence is occurring at later decades in life, particularly in developed countries where there is good access to medical care. So we know, for example, that past the 8th decade, 80 or older, the risk is much higher than it is, say, at 65. We also know that across the years of time, in the past few decades, the incidence overall has gone down a bit. We believe this is because we are managing other disease risks better.